Hey guys, it's Dr. Sean, and this is for your Fortis 105 point whatever, which is your terminology class. This is going to be week 1, module 1. Now, each week is a different module, which means when you get onto Canvas, you need to go down to the student resources or past that, and you're going to go down to week 1, week 2, week 3. Each one of these is going to have different sections in it, probably about 10 or 12 sections. Week 1 overview, interactive lecture, which is what we're kind of doing now, but we'll also be doing on Zoom. So pay attention for the announcements and pay attention for the emails that I'll be sending you. That's the main way we need to communicate. There's 4 ways in which to communicate. You can go on the Canvas cafe, which is some basic information. We'll try to keep up on that every day or so. The announcements, I'll do main announcements for these events like this video and other videos and other big points during the class, okay? Getting ready for the tests and things like that. So I've already done videos on those, and you're going to see them each week. I'll try and post them in the announcements, and I'll try to send out an email to everybody, which as long as you're getting the Canvas emails, you should be getting these, okay? So you're going to have the AHP textbook, what's it called? Table of contents, which you want to make sure you get familiar with, because this is all about terminology, and terminology is about learning how to use the words. Words are very important, especially in medicine and in healthcare. And one of the things you're going to have to look at is the differences between similar words. So for example, hematoma. Hema means blood and toma means tumor. So it's like a bruise, like a swelling bruise. Now you can have a epidural hematoma, which is on the skin, right? Or you can have a subdermal, which is epidermal, right, on top of the skin, subdermal, under the skin, or you can have subdural or epidural, which is in the brain. Those are medical emergencies. We have to know how to say those. Now, if you just said it's a hematoma, that's just a bruise. But what kind of hematoma it is, okay? So this is just one example of something that can go crazy really quick. And so learning your vocabulary is very important. The epis and epas and all of these different suffixes, the first part of the word and the second part of the word, and the prefix is the first part of the word, the root word, and where it comes from. Now, I've done a couple videos on this as well. You can look at those on YouTube because that's where I put them, and I'll be featuring one of those each week for you. So they'll have different points for you to know. Now, in terminology, we also want to understand and know that about 40% of it is Greek and about 40% of it is Latin, and the other, 20% is going to be people's names and other regular terms from English or other languages. So let's go through real quick for the week 1 stuff. We're only going to do this about 10-15 minutes, and this is the easiest way to do it. Here we got, I am on Canvas right now. I'll show you the screen that I'm looking at. This is what I'm looking right there. It has at the top week 1 overview, interactive lecture, reading, textbook contents, discussion. We'll go over that. Instructor section, lab, case studies, and chapter quiz. So those are the things you're going to have to do each week. Here's your big hint for the class. Do them as soon as you can. If you wait till week 6 or week 5 to get everything done, you're going to be so overwhelmed. There's a lot of information, but a lot of these things are designed to be pretty quick. Now, we're going to go over them each week. So if you watch the video each week, you'll have hints on how to answer these things properly. Make sure that you get, when you turn something in, that it's turned into the right format. The right format, what is that? That's going to be a doc file, a docx file, or a PDF. PNGs, JPEGs, pages, all these other iPages and all this kind of crap, I can't open, and I'm not going to be able to see them. If I can't see them, you get a big fat goose egg, also known as a 0. So make sure you get those in. Let's discuss how we can get those in better. Every one of these systems should have a way to convert to a PDF. Okay, PDF file is very important. You're going to have to get real savvy real quick on this Canvas thing and on the way that the computer works, and some of you are doing it on your phone, and that's hard to do, but good luck, man. I think you can do it. Let's look at the reading here real quick for this class. Trying to open it on my computer, and it's not wanting to open, of course. Where are we at? There we go. Textbook. Okay, reading. So this one, page 1 or whatever, week 1. Complete the reading assignment for the discussion board. Introduction to Healthcare Terminology is Chapter 1, and Chapter 2, the Body Structure and Directional Terminology, and Mental and Behavioral Health. Interesting. So we jump right ahead to Chapter 15, which is kind of unusual, but you know, these are some terms you've already seen. Psychoses, neuroses, these kind of things. Now, study direction and directional terms and body structure. There's some things I want you to write down and start looking up right away. One of them is going to be sagittal. It comes from the word Sagittarius. Sagittarius is the guy with the bow, right? If you're into astrology, yeah, astrology. He's the guy with the bow, and it's a cut this way. So if I cut my ear off, that's a sagittal cut. You'd be looking at me this way. That's a sagittal view. If we're looking frontal view, we're looking at the front. It's a cut this way down through the head, also called corona, because in Spain, it's a Latin or Spanish word. A crown or corona goes like this, not like this. This is an English style, but this is a more Spanish or Latin style. Crown comes around the top. It looks like a halo, and it's a cut this way. So if I cut my nose, that is a coronal or a frontal cut. Okay, transverse across the side. Now, even if I lay on my side, I did a whole video on this, and this little guy here helps us out a lot. If we do a transverse cut here, we also would notice that sawing all the way through, we'd be able to look down on top of him. That's a transverse view. And we would have that even if we did it this way. That's still transverse. This is still transverse. That's still transverse. Okay, there's confusion over that. What is transverse versus sagittal? Sagittal, sagittal. If we cut this way, that's coronal. Sagittal, sagittal. If we cut this way, sagittal. Okay, this is being supine, laying face up. Okay, because you could put a bowl of soup on your chest and it wouldn't spill. You're prone, face down. We do pronate and supinate in the hands. That's going to be pronate is down like this. You hold a basketball like this, right? That's a pro do that. And you hold a bowl of soup like this, supine. Okay, so those are kind of the main parts of the directional terms. We can get into more later in different parts. Let's go to the case study. Actually, let's do the discussion board. I'm going to do the discussion board with you real quick. You can take notes on this, and this is how you can fill it out. If you want to log in right now and look at it and go through the medical terminology discussion with me right now, that's a good way to get full points, because there's a couple things we're looking at when we're doing these assignments. Now, we have what's called a rubric. The rubric is how I grade. It's not willy-nilly. I don't just make stuff up. I go, that looks like a 5. That looks like a 3. We go through an actual check marks as to see what you've done based on what the question is. So, number one's a really easy one. Just make sure you get it done, right? Post your initial response by Wednesday night, 11:59 Pacific time. Pacific time. Pacific time. That's interesting, because that means over in California, it's midnight. But that means in Colorado, where I'm at, or Arizona, for example, it's going to be, what, 12:59, right? In the next one over, it's going to be 1:59, and then, which is Central, and then in Eastern time, it's going to be, what, 2:59, right? So these are, pay attention to that. If everything's Pacific time, you got to get it done as early as possible. Try not to wait till the last minute, otherwise it's late, you get a couple points off. We don't want to be late, right? That's 2 points on this whole thing, which is, I think, 20 points possible. So you're going to still get, that's still pretty good if you get it late, but let's try to get it in early, right? Before starting your week 1 topic, please introduce yourself to the class and carefully respond to the questions below. Read the questions. What name do you like to be called? People call me Dr. Sean. There we go. What exposure have you had with medical terminology? Well, I've taken years of medical terminology, and I love medical terminology because it's a way that you can understand what really is going on and express what's really going on with someone. Very specific. Medical terminology needs to be specific, and weird misunderstandings can cause people to die. So we don't want to do that, and you can miss things which we don't want to miss. Oh, what do you look forward to learning about most in this class? Most people are putting, things like, well, they want to learn how to speak better, to pronounce the words, because there's a lot of pronunciation in this class, which is very important, like mitochondria, epinephrine. See, it's hard to pronounce some of these things. How relevant is this class to your professional future? Well, that should be pretty easy, because you need to make sure that you understand the words when someone writes a report. Now, many of you are going to be caregivers. You're going to be LPNs, RNs, dental hygienists, dental assistants. You're going to be front office, back office, medical assistants, all of these things. And many of you are going to go way on beyond this and become medical doctors, chiropractors, homeopathy doctors. I don't know what you're going to be. Podiatrists. I have no idea. Dentists, probably. And you're going to have to understand the vocabulary and what things actually mean, because then you can understand what's really being said and what really needs to be done. Then explain why it is important for you to be familiar with medical terminology. For example, it might be the consequences of a health care professional to misunderstand a doctor's written or verbal orders for medication. There's a lot of medications that are very similar. Zantac and Xanax, they're totally different animals. But if you were prescribed one and got the other, you wouldn't be well. We need to understand that. Response posts. In addition to original posts, be sure to provide meaningful response to at least 2 of your peers. But this is important. Response posts. Read that part. Meaningful response to at least 2. In the first one, people are mostly saying like, hey, John, welcome to class. Really happy to have you in class too. I agree that it's important to understand words. Those are fine. But when we get into the nitty gritty and we're starting to look at actual words, I want you to use more vocabulary words and add a word to it and describe that. You need to have at least 2 sentences so I know what you're doing. Because if someone puts a really good answer for something in 2 or 3 sentences, for example, and then you put, I agree, that gets 0 points. Or maybe 1 point, because it's at least an answer. But come on, man, you need like 5 points on those ones. So we need to have good points, and we need to have good increased discussions on those. You'll never get full points if you just put, I agree, I think that's great, or whatever. It's a 3 or 4 words. It doesn't help. Last thing on those, punctuation and mechanics. If your English is a second learner, just try to work on that a little bit. I'm pretty lenient on those, but we need to work on that because many of your things are going to be written down, and we have to get a little better mastery of English as a written language because you're going to be using it a lot. You got to write reports and stuff, and if you're writing them all, I don't know, if it doesn't make sense and you're not using the proper grammar and punctuation mechanics and things like that, you're like, you're not capitalizing what needs to be capitalized. You're not putting periods at the end of sentences. You're not using the correct words in the right direction. That creates confusion, and we can't have confusion when we're doing this kind of work. So there you go. See the rubric. So like here it says select reply to join the discussion. So you can just join the discussion, and then you can look at the little dots on the side, and it'll give you open in speed grader or something, and it'll say hit the 3 buttons to see the rubric. The rubric is the directions on how to get the thing done properly. Okay, so there you go. That's an easy one right there. That's 12 minutes already. My gosh. Let's go to case study 1, case study 2, case study 3. Holy moly. And then the quiz. The quiz is going to be reading, and you're probably going to get 2 attempts at the quiz. But look at that first. Some of them you don't get 2 attempts. Some of you get 1 attempt. So make sure you get through those because those are auto-graded. Okay, case study 1. We go through here. Graded quiz. Evelyn, John, Olivia, Tina, and Julius are enrolled in a hybrid medical terminology course to which they come into the classroom only 1 day a week. Today, their instructor has assigned a group activity to practice building terms. Oh, take the quiz to answer the questions. Okay, so we go this here. This is a graded quiz. That's weird. Oh, it's case study 1. Okay, case study 1 in this case is just going to be a quiz. Inflammation. Inflammatory usually is itis, okay? Other bones like joints is going to be arthro, okay? Or rheumo sometimes, like rheumatologist, or arthritis, okay? Then we have other things. Osteo means bone, musculo or myo means muscle. And let's see other ones in here. Algia is pain very typically, like geez, I'm trying to think of cephalgia means headache. Okay, what is the term of the study of the heart? When you see heart, it's going to be cardio, cardiac. Lungs is plural. Okay, means plural. Kidneys, renal, generally. Okay, so many of these come from Latin. So if you ever spoke Spanish, you know the word for kidneys is riñón, and that's basically the same root as renal. Okay, as we get into liver is going to be HEPA, as in like a HEPA filter, and then you have different ones in there too, as in whatever. So ology is the study of, osis is a condition of, itis is inflammation of. Okay, we get in those. Eponym. Oh, eponym. Look those up. Those little mini names. Okay, that you can usually say there's acronyms and eponyms and stuff like that. Look those up. You'll be able to answer that really easy. Bones of the toes, the carpals, vertebra, dactyls, and phalanges. Phalange means point, like fingers. Then we have phalanges on the fingers. We have phalanges on the toes. We have phalangeal bones. Each one of these in here, there's 14 on one hand, 14 on the other hand. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 phalangeal bones, but only 5 phalanges. Okay, so there you go. You can turn that one in and get that one done. Let's see what the second one is real quick like. Looks like it's also Elaine Novienko. Immigrated to the United States from Russia 5 years ago and still in the process of learning English. However, she decided she would enjoy a career in healthcare. She signed up for a medical terminology class. Oh, that's one of our old students. I'm just kidding. She realizes how important it is to learn word parts to understand the meanings of terms. Epigastric. Oh, it goes through a whole list here. Epi above, and gastro or gastric is stomach. Hypo, below. She was still able to figure out the difference between the superior and inferior. Remember the following. Superior means above. Okay, that's easy. Inferior means below. Lateral means to the side. Medial means to the middle. Distal means far away. And proximal means close to us. Vast means wide. Like I said, vastus. Okay, we have many different terms there. Let's look at the quiz real quick. It's worth 6 points. Should be pretty easy to do. The abdominal, abdomen, belly, pelvic, lower parts. That's your pelvis. Okay. You're going to look at the 4 quadrants, which is the upper right quadrant. Quadrant means 4, quad 4. Okay. Right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. There's basically right in the belly button is where the quadrants are situated like this. So we have right upper, which is where the liver is, left upper, which is where the spleen is and stuff like that, intestines, left lower, and right lower. Right lower is going to be the appendix, and then all your pelvic organs and all that jazz in there. Okay, directly below the stomach. Now, abdominal pelvic regions. Ugh. So this gets into the 9 regions. Okay, now it's not the quadrants, 9 regions. So you have little lines this way and lines this way, and right in the middle is the umbilical, and then we have epigastric. All right, and then we have lumbar on the side. Doesn't make any sense. We don't use it very often. It's only used for testing. Look up the abdominal pelvic regions on there. It's a 9 segments. You're going to have hypochondriac, which is usually we think means someone's faking it, right? But it means they have pain in the hypochondriac below like in this area. So this is the cartilage. This is called the hypo. Well, this area here would be the hypochondriac. Okay, below the cartilage. That's all that means. Okay, which term bring on catabolism and anabolism. So think of cats cause a catastrophe. They break things down. They tear up the toilet paper, all that kind of stuff. Anabolism is built like anabolic steroids are the ones that the guys that you do they get big like the Hulk kind of guys. Okay, big weightlifters and stuff. Terms, simple tips, blah 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 blah. We did that one. Oh, okay. When you create something, it's to build is to anabolize. Okay, if you're looking at this, blah, 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 blah. Now the difference is the cavities. Okay, we have ventral on the front. Think of a shark. Shark has those little vents, basically the gills on the front, and they have a dorsal on the back. The dorsal cavity is on the back side, and then we have the thoracic and the abdomen. Notice there's like 4 words for everything in here, and it drives you crazy, and it should drive you crazy because it drives me crazy sometimes. Okay, case study, the last one. Here, okay, oh, this is way up into psychiatric stuff and mental health and this kind of thing. Anita Powell has been experiencing recurrent mood swings that have become unmanageable. A few weeks ago, she realized that she was not having normal functions of being happy, sad, bored, or mad. Instead, when she was happy, she was extremely happy. When she is sad, she just can barely get out of bed. So things are going way up and way down, as in like different poles. Okay. Talking to her friends, she was feeling overwhelmed and took her anger out on them. She referred to a psychologist for assessment. An additional consultation with a psychiatrist is helpful for prescription for lithobid, which is the lithium. Lithium is a kind of mineral that we can take that changes actually the way our mental functioning goes. Now, here's a weird, funky fact. Pellegrino, the water, the green bottled water, Pellegrino actually has lithium in it because those were from springs that people used to travel for miles to feel better by going and drinking the water. Lithium makes her feel significantly better. Okay, and then you take a quiz. Well, let's see what the quiz looks like here. We're going to be done in about 5 minutes. Sorry, guys, this is like 20 minutes long. It's a long one. Okay. What term means feelings of well-being, elation, happiness, excitement, and joy? Well, dis is a problem with, like dysphagia means you can't swallow, right? Eu is high, like euphoria, right? That's this one. Dysthymia. Dysthmia, sorry about that. You can have dis, and dis always means a problem with, so you can write those off, right? Which term means intense feelings of depression? Well, it's not euphoria, is it? We knew that one. Question 3, what terms, disorders, characterized by... Now, here's one of the best things to do with this. You do have time on these quizzes, so take each one, type in euphoria, and look at the definition. Type in dysphoria, and look at the definition. Type in cyclothymia, and put in the definition, and you'll be able to have them then, and you've got to get these things in your head from your hands. So I suggest take quick notes. You don't need to see them again, but write euphoria, E-U-P-H-O-R-I-A, and euphoria means increased mood or happiness, whatever. Right? I'm euphoric, and I'd be euphoric if you guys did that. What does combining the psycho term in psychiatrist and psychologist mean? Crazy, unstable mind. So a psychiatrist, a psychologist is one who studies the mind, not studies the crazy. You can say someone is psycho, as in psychiatric, or psychotic, and that would be like their mind is not really connected to them. You can look those terms up. Anyway, this is Dr. Sean over at my channel, The Center Path. Make sure you hit the like button. Hit the subscribe button. If you want to comment, you can totally comment. I appreciate those. Those do help the algorithm, which keeps it in kind of your front if you're on YouTube quite a bit. I will put the links in your announcements and things, so make sure you look at those. And this is to help you with these assignments, okay? You guys can pause things, you can slow it down, you can speed it up, whatever, and it should help you get your A's that you will deserve if you do the work. I don't give out grades. What I do is I evaluate and look at, and I hit the check boxes and make sure you guys get the grades that you have earned, okay? This is Dr. Sean. Take care. Let's get on the discussion boards. I will answer at least half of you, or get in there and talk on the discussion boards with you every couple days. It'll be about the discussion itself, and we'll go from there. So look out for the Zoom meeting, which is coming up soon, and we'll go with that. You guys take care, and we'll talk to you on the flip side. Bye.